Hello everyone, welcome to AY Tutorials. Today we are going to study hypertension. In this video, we are going to study what is hypertension, what are the different consequences of untreated hypertension, how the hypertension starts and it causes, and the treatment and the management of hypertension. Understanding the hypertension. What is hypertension? Hypertension is nothing but the high blood pressure that occurs when the force of blood pushing against your artery walls is consistently too high. So it occurs when the pressure in your blood vessel is consistently too high, which can lead to the serious health complications like heart attack and stroke. Uh, it is also known as the silent killer as it often develops gradually over the time without noticeable symptoms and making your regular checks crucial. This hypertension is often asymptomatic and meaning many people may not realize that they have it until it is detected during the health screening. So it is important to manage the hypertension to prevent long-term health issues. The impact: your heart works harder to pump the blood, which can damage arteries and lead to the severe health problems. Consequences of untreated hypertension. Untreated hypertension can severely damage the blood vessels and organs and increasing the risk of heart disease, stroke, and other brain issues. Heart disease in that coronary artery diseases, heart attack, heart failure, and enlarged left heart. So, high blood pressure can cause the damage to the arteries, which leading to the conditions like coronary artery disease. And over the time, the heart has worked harder, which can result in the heart failure or heart attacks. Then, stroke and other brain issues. Stroke or transient ischemic attack, that is TIA, then dementia and mild cognitive impairment. Hypertension increases the risk of stroke by causing the blood vessels in the brain to either burst or to become the blocked. This can lead to the significant brain damage and long-term disability. How hypertension starts and its causes. Primary or essential hypertension. It is the most common type of hypertension. 90 to 95% of adults are having this type of hypertension. No single identifiable causes or develops over the time from the combination of factors. So, this primary hypertension is in the world of cardiovascular health. The primary hypertension stands out as the predominant concern, and it is characterized by the persistently elevated blood pressure with no identifiable secondary cause. Previously labeled as the essential hypertension, and this condition it affects a significant portion of the adult population globally. There are certain key risk factors of this primary hypertension, which includes unhealthy lifestyle, uh, lack of exercises, poor diet that is high in salt or processed foods, unhealthy fats, then obesity and chronic stress. These are the some factors for the primary hypertension. Then genetics. There are certain family history that can increases this hypertension. Family history significantly influences the a likelihood of developing the hypertension and suggesting a hereditary component. Then age. Blood vessels becomes less elastic with the age. The risk of hypertension increases with the age, which attributed to the physiological changes in the vascular system. And then obesity is one of the problem. Excessive food intake, or particularly central obesity, is closely linked to the hypertension as it strains the cardiovascular system. Then race. Certain racial groups like black people in the United States are having higher prevalence. How hypertension starts and its causes. In that, secondary hypertension, it is caused by an underlying health conditions or medication. Then it tends to appear suddenly and often causes high blood pressure. So, the secondary high blood pressure is a high blood pressure that's caused by another medical condition. It can be caused by the conditions that can affect the kidneys, arteries, heart, or endocrine system. The secondary hypertension can also occur during the pregnancy. Secondary hypertension, it differs from the usual type of hypertension, and which is often called simply high blood pressure. The proper treatment of the secondary hypertension can often control both high blood pressure and the condition that causes it. Effective treatment, it reduces the risk of serious complications, which can include the heart diseases and kidney failure and stroke also. Then the common causes of this secondary hypertension: kidney diseases, obstructive sleep apnea, thyroid, adrenal gland problems, certain medications like cold remedies, birth control pills and painkillers, then illegal drugs like amphetamine and cocaine. Consequences of untreated hypertension, in that kidney damage, it can lead to the kidney failure. There are some mechanisms of this kidney damage. It includes narrowing of blood vessels, impaired filtration, then scarring of the kidney tissues, and finally the cycle of damage. High blood pressure causes the arteries in the around and the kidneys to narrow, weaken, and harden, and which reduces the blood flow to the kidneys and depriving them of the oxygen and nutrients they need to the function properly. And this is how the kidney damage occurs. Then eye damage, retinopathy, then optic neuropathy, it affects the vision. So this eye damage can occur. And then aneurysms, weakening and bulging of the artery walls with the risk of rupture and life threatening bleeding. Then sexual dysfunction, in that erectile dysfunction in the men, then reduced libido, vaginal dryness and difficulty with the orgasms in the woman can occur due to untreated hypertension. Treatment and management of hypertension, in that lifestyle modifications, they are very crucial, like healthy diet, regular exercise, weight management and limited alcohol consumption. Healthy diet, it emphasizes the fruits, vegetables, whole grains, lean proteins, limit processed foods and unhealthy fats and sodium. Then regular exercises, aim for at least 150 minutes of the moderate to intensity aerobic exercises weekly. Then weight management, achieve and maintain the healthy weight. Then limit alcohol. Excessive drinking can increases the risk of blood pressure. Quit smoking, significantly it damages the blood vessels. Then stress management, techniques like medication and deep breathing. Then medications prescribed by the doctor. Take the medications which are prescribed by the doctors only, then often started at the low doses. Examples: beta blockers, alpha blockers, calcium channel blockers, SC inhibitor and ARBs. Important note: always consult a healthcare professional for the proper diagnosis and the treatment of hypertension. Never self medicate or alter your treatment plan without the medical guidance. This information is for the educational purposes only. If you like this video, please like, share and subscribe to the AY tutorials. Thank you.